everyone, welcome to Know Your Health Tuesday with your favorite family doctor, Dr. Lesego from Blue Heart Medical. Today we'll be talking about adenomyosis and endometriosis. What's the difference between the two? Is it the same thing? So not quite, they're not quite the same thing. Adenomyosis is when the endometrial tissue, that is the tissue that lines the inside of the uterus, actually grows within the uterus muscle. So that is not great because it can cause a number of complications. It can cause painful menstruation, excessive bleeding, and sometimes even infertility issues. So some people also experience painful intercourse. So it's a good idea if you do have menstrual pain to see your gynae and make sure that everything is okay. I know as women, we tend to get used to having menstrual pain, and even society will tell us, no, it's just that time of the month, you'll be fine. But menstruation isn't supposed to give us excessive pain. So if you have excessive pain, please come through to your GP or your gynae and let's have a look. In terms of endometriosis causes severe pelvic pain or low abdominal pain during menstruation. So sometimes the pain actually starts a few days before the actual menstruation and lasts many days into the menstruation. So please do have a look or go through to your gynae to see if you do not have endometriosis, if you're experiencing severe pain. I know of women or even students, children in high school who actually miss a couple of days of work or at least one day of work or school once a month because the pain is so excessive. That's actually not normal. Please do go through to your GP or your gynae and let's have a look and see if it's not endometriosis. So some of the other symptoms is painful periods, pelvic pain and cramping, lower back pain, stomach pain, pain with intercourse. It's quite common. And unfortunately, endometriosis can also lead to infertility. So what endometriosis does, these cells within the uterus actually go out of the uterus. It's called retrograde menstruation. So instead of coming down out through the cervix and through the vagina, it actually goes up through the fallopian tubes and ends up in the pelvis. So sometimes it can line your bladder, your uterus itself, your colon, and those cells still act as if they're in the uterus when they're out in the pelvis. So that's why it can cause bladder symptoms, pain when you're passing stool, pain when you're passing urine. And because during your period of menstruation, the cells will still cramp up and still act as if they're in the uterus. So it causes a number of problems there. It can even line your ovaries as well. So it's something that is quite serious. We need to have a look, go through to your gynae and let them diagnose you and let you know. It can potentially, especially early stages, both of these can be controlled with contraception or hormonal treatment, which basically controls the cycle. So it can relieve some of the symptoms. But when it's very late stage, usually it will need surgical intervention. So that's adenomyosis and endometriosis. We had another question where somebody was asking that her periods have gone AWOL for 2 years. Okay, that is quite a long time for your periods to go AWOL. And it could be from amenorrhea, meaning you're not actually ovulating. Because when you menstruate, it's because the egg has come out, it wasn't fertilized, and then the body releases it, and it basically releases the blood that was accumulating in the uterus. So if there's no ovulation, sometimes then it can cause amenorrhea. Also, if you've been on contraception, for example, the depo, which for some people has a complication, a known complication of not menstruating, there's times when it can last quite a long time in your system, up to 2 years for some people. So if you've been on any kind of depo contraception, speak to your GP. There are options that we can try and assist for you to get your cycle back. But always a good idea for you to consult so that we can check your hormone levels and see that everything's okay. Your gynae can do an ultrasound as well to see that everything is functioning well. So what are polyps exactly? Polyps are small growths that grow in the mucosa. So the mucosa is that lining within your nose, your mouth, or throughout your gastrointestinal tract. So that's your stomach, your colon, even your rectum. So polyps are, some of them look similar to the uvula, you know, the thing that's hanging at the back there. Some of them look similar to that. But basically, it's small growths that just grow throughout anywhere in your body really. So nasal polyps will be diagnosed by your ENT and they can be surgically removed. And then the most popular or the most common type of polyposis is called familial adenomatous polyposis. Familial adenomatous polyposis. Okay, FAP in short. So with FAP, I'll talk a bit about FAP because it is the most common. You can get the lesions anywhere in your stomach really. Stomach, colon, rectum. And it is hereditary, so it is you do get it genetically. So families will tend to have it within the family. Screening for this polyposis can start as early as 10 years of age. So screening would be a colonoscopy. So if there's anyone in your family with this type of polyposis, it's a good idea to get a colonoscopy every year. And some people do get it as early as 16 years. So once it's been identified, in early stages, it is easy enough to just remove the specific polyps. But over time, they tend to spread and grow such that there's a lot of them, and removing the individual ones becomes a bit difficult. So at late stages, you might find that they might remove or have to remove segments of the colon. So symptoms include constipation, diarrhea, bleeding from the rectum, and abdominal pain. So if you experience those things chronically, or any kind of bleeding from the colon, you need to get it checked out, or from the rectum, you need to get it checked out. But if you have chronic constipation, chronic diarrhea, it's a good idea to get it checked out. So come through to your GP for a referral for colonoscopy with a gastroenterologist. Okay. There is a risk of cancer with FAP, very high risk of colon cancer, and there is a risk of other types of cancer. So can get duodenal cancer, papillary thyroid cancer, pancreatic cancer, stomach cancer, spinal tumors even. So these papilloma can form in other parts of the body. So some people might experience impacted teeth. They may experience bumps or lumps in the skin. They can experience benign bone tumors and pigmented lesions in the retina of the eye. So polyposis, it's a good idea if anyone in your family has polyposis to get your annual colonoscopy and make sure that you don't have the same, or if it's there, it can be treated early enough. I hope you found this helpful. If you have any questions or comments, let us know. If you have any other questions for Know Your Health Tuesday, please DM us or send it in the comments. I'm looking forward to answering your questions again. Keep well, keep healthy and safe.